with coverage you can count on. This is News Channel 8 at 5:30.
If you've ever gone under for a procedure, it can be pretty nerve-wracking, and that's why physicians in Connecticut are trying to reassure patients about anesthesia. When a medical procedure requires general anesthesia, patients are understandably anxious about going under.
My whole fear was I going to wake up after it?
This is the surgical center where
it's going to happen pretty quick.
Diane DeLucia was put to sleep for a colonoscopy.
You hear a lot of horror stories about everybody's problems that they've had, and so I guess it sticks in the back of your mind.
And there is a small percentage of people who report waking up during surgery.
No patient should feel anything under anesthesia. Anesthesia appropriately delivered should result in a patient that does not feel anything. They're asleep and they're not feeling anything, and that's the vast majority.
Anesthesiologist Dr. Robert Goldstein says patients should ask a lot of questions.
What kind of anesthesia am I receiving? And if they say you're going to be asleep for this procedure, the next question will be who's giving me the anesthesia?
And patients can request meeting the person who will administer the drug.
You may want to find out, how good is this person? Have they, have they worked with the surgeon before? Are they experienced in this procedure?
A well-informed patient, doctors say, is more at ease.
Once we explained it to them first at the time of their first interview, then here again when they come in for their procedure, and then subsequently the anesthesiologist speaks with them, most of them are fine with it.
Most wake up just like Diane DeLucia.
To be truthful, can't remember a thing. So all I can tell you is once you're out, that's it. You wake up, and basically your first question is, when are they going to start? And they're already finished.
Dr. Goldstein says there are surgeries that require patients to receive medications so they cannot move during the procedure, and he points out if they cannot move, they cannot alert anyone if they are awake. Now, there is some controversy going on right now over the anesthetic drug propofol. The College of Gastroenterology filed a petition before the Food and Drug Administration asking trained gastroenterologists be allowed to give the drug. Supporters say it will eliminate the anesthesiologist's fee, thereby reducing the cost of diagnostic procedures which require the patient to be asleep. Opponents say safety is a big concern.
It adds another dimension to what we have to do, and like I said before, our job here is to get the procedure done safely, and we leave the anesthesia to the professional.
When the gastroenterologist is properly trained, the studies have clearly shown in well over 100,000 patients that gastroenterologists can safely administer this medication.
Connecticut is one of 12 states that bans registered or licensed practical nurses from administering propofol.